Did you know osteoporosis is often called a silent disease? It's true, and here's why. Osteoporosis is a bone disease that develops when bone mineral density decreases, or when the structure and strength of bone changes. This can lead to a decline in bone strength, increasing the risk of fractures. It's the major culprit behind fractures in postmenopausal women and older men, with breaks most commonly occurring in the hip, spine, and wrist. Interestingly, this disease is most prevalent in non-Hispanic white women and Asian women, with African American and Hispanic women having a lower risk. Among men, non-Hispanic whites are more commonly affected. Despite women being more prone to osteoporosis, it's important to remember that older men from all backgrounds are also at risk. So, osteoporosis is a challenge faced by many, but often silently. Now let's delve deeper into the causes and symptoms of this silent disease. You might wonder, what triggers the silent disease? Let's explore. Osteoporosis, quite simply, is the result of an imbalance in the natural process of bone formation and breakdown. Our bones are continually undergoing a process called remodeling, where old bone is broken down and new bone is formed. However, with osteoporosis, the creation of new bone can't keep up with the removal of old bone, leading to a significant loss of bone mass. This imbalance can be triggered by a variety of factors. Certain medications like cancer drugs and glucocorticoid steroids can accelerate bone loss. It's important to note that while these medications can increase the risk of osteoporosis, they are often necessary for treating serious conditions, so it's a delicate balance that doctors must manage. Another common misconception about osteoporosis is that it's a women's disease. It's true that women are at a higher risk, particularly after menopause when estrogen levels drop dramatically. Estrogen is a hormone that helps protect bone health, so its decrease can lead to increased bone loss. However, men aren't immune. While men have larger bones and higher peak bone mass than women, their risk increases, especially after the age of 70. Moreover, slender, thin-boned individuals, regardless of gender, are at a higher risk because they have less bone to lose. Ethnicity also plays a role, with non-Hispanic white and Asian women, and white men being at the highest risk. Additionally, your risk can increase if one of your parents has a history of osteoporosis, indicating a potential genetic component. Diet also plays a crucial role. A diet low in calcium and vitamin D, essential nutrients for bone health, can increase the risk. Excessive dieting or poor protein intake can also contribute to bone loss. In conclusion, osteoporosis is a complex disease with multiple contributing factors. It's not just about gender or age, it's about bone health, medication use, lifestyle choices, and even genetics. As we've seen, osteoporosis can be sparked by a variety of factors, and it doesn't discriminate based on gender. But how would you know if you have it? Imagine a disease that shows no signs until it's too late. That's osteoporosis for you. Osteoporosis is often referred to as a silent disease. The reason? Well, it typically doesn't present any symptoms until a bone fracture occurs. And these fractures are not always the result of major accidents or traumas. Even minor falls, or normal stresses like bending, lifting, or even coughing can cause these fractures. Imagine bending over to pick up a dropped item and ending up with a fractured bone. That's the harsh reality of osteoporosis. When it comes to vertebral fractures, the symptoms can be more noticeable. These can include severe back pain, a significant loss of height, or even spine malformations that result in a stooped or hunched posture. The silent nature of osteoporosis makes it difficult to detect, but knowing the risk factors can help in early detection and prevention. You're now aware of the symptoms, but what increases your odds of developing osteoporosis? Let's find out. Some factors that may raise your risk include gender, body structure, and race. Women, particularly those of white or Asian descent, have a higher risk due to lower peak bone mass and smaller bone structure. Men, especially those over 70, are also at risk, with white men having a higher likelihood than African American and Mexican American men. Body structure plays a role too. Those who are slender or thin-boned are at greater risk because they have less bone to lose. Your family history also matters. If one of your parents had osteoporosis, your risk may rise. Hormone levels can significantly impact your risk. Women with abnormal absence of menstrual periods due to hormone disorders or extreme physical activity may have lower estrogen levels, increasing their osteoporosis risk. In men, conditions causing low testosterone also raise the risk, though the natural decrease of testosterone with age isn't usually a major factor. Your diet is another key player. A diet low in calcium and vitamin D can increase your risk for osteoporosis and fractures. Excessive dieting or poor protein intake may also increase your risk for bone loss. Certain medical conditions such as endocrine and hormonal diseases, gastrointestinal diseases, rheumatoid arthritis, certain types of cancer, HIV/AIDS, and anorexia nervosa can heighten the risk. Also, long-term use of certain medications like glucocorticoids, anti-epileptic medicines, and certain cancer medications may make bone loss more likely. Lastly, lifestyle factors can contribute to bone loss. Low levels of physical activity and prolonged periods of inactivity can lead to poor physical condition, increasing the risk. Chronic heavy drinking of alcohol and smoking have been identified as significant risk factors for osteoporosis. Knowing these risk factors is half the battle won, but remember, prevention is better than cure. Stay informed, stay healthy. It's time to summarize what we've learned about this silent disease. Osteoporosis, a bone disease, results from decreasing bone mineral density and changes in bone structure, leading to weaker bones and a higher risk of fractures. The most affected bones are in the hip, spine, and wrist. This condition is most prevalent in non-Hispanic white and Asian women, but it doesn't discriminate. Both older men and women from all backgrounds can develop it. The disease often goes unnoticed until a bone breaks, with symptoms of vertebral fractures including severe back pain, loss of height, or a stooped posture. Risk factors vary from gender, bone size, ethnicity, family history, hormonal levels, diet, certain medical conditions, and long-term use of specific medications. Even lifestyle choices, like physical activity, alcohol consumption, and smoking, can contribute to bone loss. Osteoporosis might be silent, but you don't have to be. Stay aware, stay proactive, and remember, your health is in your hands. Thank you for watching.